Welcome to the Beats with Kelly Kennedy, from our hearts to yours. And today is a deep heart for me because today we are recording this on my father's birthday. And for those of you who don't know my story, my father had cancer, had Hodgkin's disease, and I wanted to find the cure to cancer. I wanted to find how I could never get cancer. My life led me into a car accident. I ended up in pain. I met my husband. I got out of pain. 12 years later, we were introduced to one of my most incredible mentors, lifelong friends, and incredible scientists, doctors, Dr. Thomas Rau, who I'm very honored and privileged to be able to bring to the world today. Many of you know of Dr. Thomas Rau, and he is a wealth of information, incredible speaker, and you're going to be able to hear from him today how your body really works. And this is an incredible gift that I get to give all of you on my father's birthday, because if you want to know how to prevent cancer, how to not get cancer, and what the real story is, this is the guy. Thank you so much, Dr. Rau, for being here with us today.
Thank you too. Thank you for inviting me. And as it is such a personal thing, I don't approach in white coat and no tie and no stethoscope around the neck. But I hope that I still can answer the question.
Oh, we love seeing you a little bit more on a personal touch, and from my heart, I just want to thank you for bringing this medicine to the United States. And I know that without you, so many of us wouldn't know about this form of medicine and the concepts of regulation. So, and we're going to talk about how, if you're interested at the end, we'll talk about how if you're interested in learning this medicine, Dr. Rau is still teaching, thank God, and he's still out there training doctors across the international platform, because he is an international doctor. But Dr. Rau, could we just start with just the basic concepts? Let's pretend somebody has never heard this concept of bioregulatory medicine or biological medicine. Can you explain what that means and a little bit about you, maybe?
Yeah, well, it is simple and still complicated, because what we do is to treat diseases and patients who had not been successful with their treatment, and they have so-called unclear diseases or difficult diseases, and their treatment until they came to us, it was just suppressing or against the symptoms. We treat the causes, and we found techniques to evaluate the causes. And to make it, as I do a lot of teaching worldwide, I had to bring it to a simple dimension, so that doctors all over the world can practice this. And we brought biological medicine down to three pillars. Which cover the most important. I would say these pillars, they cover about 90% of the causes of all so-called unclear diseases, and also cancer. Cancer has causes. So, well, we are already deep in the topic. I said cancer has causes.
Causes, that's right, because one of the things when I met you, everybody in America is like, what's the cause? What's the cause? And the first thing you said was, cancer is multi-causational.
Exactly. But all the unclear diseases, they are unclear because orthodox medicine does not touch the causes, the multi-causality. And that's what we try to do. So, and when you look at the causes, the most frequent that when I look at 1,000 patients who came in the last years to us, then I found root cause number one nowadays is toxic load. Toxic load makes autoimmune diseases. Toxicity makes cancerous changes. It's cancerogenic. Toxicity makes the immune system change so that you get allergies and so on. So, but you have to find the toxins, and nowadays there are so good toxicological findings which you can do. But when I see the patients who came from wherever, they came with bags of documents from Mayo Clinic and from wherever they might have gone. So never been analyzed for toxic load.
So they're testing all these other things, but they're not looking at toxicity of the body, is what you're saying, just so everybody's clear.
Yes, good. Toxicity of the body, which blocks the cells, which even can make epigenetic changes. And epigenetic changes means gene changes later on in the life. You know, the genes, it's not just given by birth and then they stay the same. No, they can change. And the change, which makes to cancerous, which makes to changing of immune cells and so on, is, I would say 90% it's toxic load. And we can test organic, which is like hormone-like factors, like sprays, like pesticides, all these kind of things, colorants, and so on. And inorganic toxins. Inorganic toxins come from teeth, mercury, cadmium, lead, tin, and so on, arsenic. And when you look, let's say one example, I'm very, well, we are overrun by autistic children's cases, you know, horrible. I could cry because these families, they suffer so much, and what do they get? Nothing, more or less nothing, but calming down the child, which decreases the development even. And but when you look at them, they are always toxically loaded, and very often it's aluminium, very often
aluminum, for those of you
aluminum or silver. Or where does it come from? It comes from food. It comes from how do you say, the packages of the food. It comes from the drinking bottles, you know, the tins.
The plastics, the packages, the processing of the food.
Exactly.
Yeah, the chemicals on their body, from makeup, hair care, chemicals. And I just want to reiterate what you said. It's so key, and it's why I cried for the first 5 hours that I heard Dr. Rau speaking, because it was relief. You know, I lived in a household where my father had Hodgkin's disease, and so we didn't know if I would get it. We didn't know at that time if it was genetic, and I looked at his lifestyle after I met Dr. Rau and realized that his lifestyle was conducive to allowing his genetics to turn on for that cancer. And that's what you're talking about with epigenetics, that toxicity can turn on cancerous disease. It doesn't have to be just your genes, and your genes can change based upon your environment, correct?
Exactly. So this is number one, which we evaluate. And there are evaluation techniques which are deep into chemics. It's not, you know, biological medicine is not just in the mindset of some crazy doctors. No, we are very scientific, and we are very cellular, molecular evaluation we do. So our medicine is a very scientific kind of approach, but on a cellular level and on a lymphatic level and on a metabolic level. So this is number one, is the toxicity evaluation, very detailed treatment. The treatment always takes long because these toxicities deep in the tissue. Second cause, more or less always together, always, is the intestines, which include the immune system and the autonomic nerve system. So it's the three things. When I had a very good internal medicine education, and I was at the best university, but honestly, I heard nothing about the small intestines. And the small intestines are the biggest organ of the body. So, and they are home of more than 90% of the immune cells in the Peyer's patches. Never heard about this. Well, and the patients come and they have autoimmune disease, they have Hashimoto's, they have rheumatoid arthritis, they have lupus and all these diseases, or even multiple sclerosis. They go to the so-called specialists. I'm so sorry I call them so-called specialists because they don't know biological medicine. If they would be knowing everything about the disease, they would have to know my medicine too. So, well, they go to these doctors and not even tested for the immune system, but they have an autoimmune disease. Oh. So, and you can change your or the patient's immune system by changing the small intestines.
Can you explain really quickly what the Peyer's patches are? Because, again, I mean, the amount of wisdom that comes from this man. You know, the small intestines are your largest organ in your whole body, and they're not taught about it. And the Peyer's patches, which, can you explain what the Peyer's patches are in the small intestines? They kind of look like little lily pads, and they kick out these white blood cells. But you explain it in your words.
Where, where are the immune cells which you need for against cancer?
And viruses in our current environment.
Yes, exactly. Which you need for eliminating or grading down the viruses now, the coronavirus. So, well, anyway, you need these cells. And where are they in the body? Well, they are in the lymph nodes. Well, but where are the lymph nodes? Of course, along the neck and the aorta, but 90% in adults are along the lining of the small intestines. And these little lymph nodes, they are called Peyer's patches.
It's Peyer's patches, yep.
Peyer's patches. And they include more than 90% of a normal adult's lymph system, lymph cells.
So when a lot of naturopaths say the health is in the gut, maybe they should say the health is in the small intestines and the Peyer's patches.
Exactly. But the gut is, the main part of the gut is the small intestines.
Thank you so much for that clarity. That was amazing clarity. Thank you.
Yeah, and even more important is that this small intestines lining, the mucous membranes, they also have hormonal effect. For example, dopamine, serotonin, and histamine, they are produced in the small intestinal lining. So isn't it fantastic and fascinating that you can even influence a Parkinson's disease by increasing the dopamine production, the small part of the dopamine production, which comes from the small intestinal lining. Or the psychological situation of a patient, it's not only psychiatry. No, it is a lot of hormonal. And serotonin, your luck hormone, is produced more than 90% in the lining of the small intestine. So you see that this organ has many function. And it is, even if I can change or make the small intestinal function, this gut function better, 10%, 20%, it is such a big organ that it has the biggest influence to the whole body. So we never use, only as a little example, we never have to use antidepressants. We treat the small intestine so that serotonin increases and depression goes away. It's fantastic. It's not like this today and tomorrow, but it's over several weeks. The patients feel a significant change.
So instead of suppressing the feelings of depression with an antidepressant, You go and look at what the toxicity of the client is, what their largest organ, their gut health, their immune system is doing, and go, let's upbuild the immune system capacity to deal with that toxic load, and that allows the body to heal. And then as the body is allowed to heal, naturally the serotonin and dopamine come up, correct?
Exactly, absolutely exactly. The third pillar, well, no, still let's stay a little bit more at the small intestine, because the small intestine is also a uptaking organ for food, for nutrients, and it is also a detoxification organ. So, because there is a big lymph flow into the intestinal system, and from there back to the body. So, so this lymph node, where if you do better lymphatic, how do you say, flow? Drainage, yep. Then you also have a better detoxification, which goes through the gut.
So you can see why my teacher here, you know, I've created a technique called flow, fascia lymph overall wellness. We haven't had a chance to talk about it, but this is a technique after 15 years of understanding this medicine and knowing what I know. I got to the conclusion that we need to get people to flow. They want an immune system, they need to flow. And that was brilliant. Thank you so much. I mean, if you want your immune system to flow, you got to work with your small intestines and your lymphatics to get the energy, and the healing to flow. And this exactly. is cellular. This isn't woo-woo medicine. This is cellular medicine.
Yes, yes. And there is another part to the intestinal system, to the gut, and this is the bacteria. The gut
yes.
bacteria, microbiome it's called now. Now, even the scientists, they go now to research microbiome. Natural medicine doctors, they do this since 100 years, so this is nothing new. It was always the gut endobiome, the microbiome was always a very important part of our medicine. And we test day one, a patient comes to us, day one, whatever they have, we test the intestinal system and we test the microbiome. And very interesting, we did more than 1,000 tests on cancer patients within the last, let's say, 10 years. And not a single cancer patient had a normal microbiome, which would detoxify and which would nutrify the patient. So every chronic patient, especially every cancer patient, always has an unhealthy intestinal system and needs a treatment. Lymphatic treatment, a intestinal treatment, upbuilding of the microbiome.
I remember when your first class, and he's such an animated speaker, as you can see, you were literally jumping up and down and talking about a bag of bacteria.
Exactly, yes. Well,
because we're more a bag of bacteria. I remember you saying, I am more a bag of bacteria than I am Thomas Rau cells. And that always stuck with me.
Exactly. You know, when you look at me or at yourself, 60% is water in your body. And so you are a water bag. And then you have some cells, and the cells, about 90%, nobody really talks about this, are intestinal, are the microbiome, the bacteria. You have more bacteria than you have Kelly Kennedy cells. So what all, look at me, I'm a water bag filled with bacteria. And some Thomas Rau cells, of course. Yes. But knowing this and how important they are, it gives us a totally different approach to bacteria and to viruses. We know that the viruses are not the problem. We know the lymphatic system is the problem, which would bind these viruses.
That is huge what you just said. The virus isn't the problem, it's the lymphatic cells. And everybody's using this antibacterial soaps, and they're going to create long-term chronic illness, as you and I both know, with all these antibacterial soaps we're using during this COVID. And that is huge. Nobody is talking in America anyway about the immune system. They're not talking about it. They're telling put a mask on and stay inside and don't touch people. They're limiting their microbiome instead of expanding their microbiome. They're not upbuilding. They're not spending time outside. Isn't it like the exact opposite of what you would do personally and what you would recommend to your clients?
Yes, of course. Honestly, we have with COVID, with coronavirus, we have no problem at all. Not a single patient who got severely sick, even if they tested positive. We have many who tested positive. It's like all the other years they had the flu, and now they have corona. So, but we increase the immune system with some remedies, natural remedies, with vitamin D, with selenium, with vitamin C, and with zinc, and they get healed within several days. Absolutely no problem at all. Not a single case. So, but let us go back to the 3 pillars. The third pillar is to upbuild the body. So, in 7 years, not a single cell which you have now is the same. You fully renew your body permanently. While I'm talking with you, millions of cells, mainly intestinal bacteria cells, they rebuild. So it's a permanent renewing process. Okay, the patient comes with a osteoarthritis, the patient comes with a diseased liver, comes with a whatever they have, and they need better cells in these organs which are diseased. But do they get stimulation of, let's say, liver upbuilding cells, or of the cartilage of the joints when they have osteoarthritis? Are they doing something to rebuild? They also rebuild. Even the brain cells. American scientists found out that even the brain cells recover. I learn a lot from American modern science because they found such things. But are you doing? Your grandmother gets towards Alzheimer's, or you have cognitive decline, or the little child has autism, that the brain makes like this. Are you changing these cells? Are you trying to build up better new brain cells, or better eye cells when you have macular degeneration? No, not a single patient who came to me. We have such good results on macular degeneration. No macular degeneration.
Macular degeneration. Yeah. He has a lot of results. There's
it's
a lot
only
of.
One,
I don't know. There's much you don't get results with. To be honest, Dr. Rau, I don't think there's much you don't get results with, but he gets specifically great results with macular degeneration, with arthritises, with cancers, with nervous system disorders, autism. See how the list is going on and on. Go ahead. Sorry, I didn't mean to interrupt, but your results speak volumes.
Yeah, because, well, I do this since 30 years. So, well, the results you do not get with orthodox medicine because you don't stimulate the rebuilding of the new cells. And you do not eliminate the causes why your cells are so sick. Only these two things you have to do: detoxification and specific upbuilding. Well, macular, as an example of the brain cells, they need a lot of, phosphatidylserine, phosphatidylcholine, carnitine, taurine, all these substances which we activate very, very specifically.
Those are amino acids, which are building blocks to the body, and they're specific for the nervous system, so the body can utilize those. But, you know, really what this all speaks to, the volumes of, is what I want people to understand is that he didn't say I had to go and cut something out, I had to go take something away, I had to suppress something. What he said was, I'm going to evaluate the body, what the body's up against. I'm going to look at its immune system's capacities and test that in very specific scientific quantitative values. And then I'm going to upbuild the body, because this premise is that the body has the healing capacity. And I call myself a biological investigator because I'm not a doctor, and I've been training with Dr. Rau and many of his colleagues in Europe for almost 16 years now. And what it really taught me was that I can learn how my body works, and I can learn how to, there's so many home care things that Dr. Rau has taught throughout the years, castor oil packs, coffee enemas, you know, lymphatic drainage, whatever the case may be, to help that upbuilding, that we're not dependent upon a medicine to feel well. We are dependent upon our own systems to heal, and we have that healing capacity in our body. You know, I can tell you right now, I look younger today, and Dr. Rau, I've known you for 15 years, and honest to God, you don't look a day older than the day I met you. And you've been through some physical stress. You know, he had an accident many years ago with a motorcycle because he likes to have fun. And, you know, but he jumps up and down. And may you just share with everybody your youth of, like, how young are you, Dr. Rau?
Well, I just became 70.
Happy belated birthday.
Yes.
And he's so thriving at 70. You know, that's the difference. He thrives because he's working with his immune system, and he teaches all his patients to do the same, and he teaches doctors to get their patients to do the same. And that's how the body really works. We have the healing capacities within us. We want to empower you to understand the same. You have the capacity to heal no matter what diagnosis you're up against. Is there any diagnosis that you feel is insurmountable, Dr. Rau?
You can influence every disease to the good. Of course, there are diseases where it's simpler, like allergies or immune diseases and such things. And there are other diseases which are much more difficult, like brain degeneration or cancer. Also, cancer needs a very intensive multi-modular approach. But of course, it was very interesting now. We had Corona, lockdown, and we had lockdown in Switzerland too. From one day to the other, nobody expected, and we had patients here. And some of the patients, they said, well, they had the money and the possibility. They said, we stay in Switzerland. They did not go back. Even they could have gone the first several days. They were still allowed to go back home. But they said, we stay. So we had a very rare opportunity. Patients who just stayed for 3 or now 4 months.
Wow.
And they did an intensive cancer treatment. We had 3 patients with a stage 4B hopeless case cancer. 2 of them were pancreas cancer. And they said, well, we just stay here. But why should we go home? We have no treatment to Malaysia, or one to India and one to Germany. Why should we go home? We stay. And so we did the treatment, full power the whole time. And after 6 or so weeks, the cancer began to shrink. They felt better much earlier, and all of them had a significant reduction of tumor size, all of them.
Wow.
This was something which we did not do before, because normally we do a 3 weeks treatment and then they go home back. 3 weeks is not enough. Of course, they do continuation of treatment at home.
Right. And that's what happens when you're desperately ill, and there's so many therapies that they can do in Switzerland that are just not allowed here in the States or in Malaysia or Germany or the different. I mean, he has an international practice. People travel from all over the world to go see him, and mostly because of his expertise, as well as the fact there are some things that with his expertise that can just not be done in other countries. And so I've always said I want to go to the clinic just like once a year for a month and get a brand new body, because in Dr. Rau's many books that he's written, particularly The Future of Healing, he gives you a chart that tells you exactly how long it takes for different organs to regenerate. I mean, it's absolutely amazing. When I first read that, I was like, wow, look at this man. He is just out there going, here, I scientifically proved that you can have a liver, and it's 7 months, I think, for the liver. Is that right, Dr. Rau?
Yeah, 6 months or so.
I mean, that's incredible. And these people were given a death sentence, and they're going to die, I'm sure, at some point, but now they have a better quality of life. Their numbers are shrinking, and it's reversing because their body is healing. I got total chills throughout my whole body when you told that story. And cancer doesn't have to be a death sentence, no matter what stage it is. There's always hope. And I remember somebody asked you that question at one of our seminars, and you were like, I love Dr. Rau, if there's a fire, please excuse me, if there's a fire in your belly, you can always heal. And I just, that's brilliant. And how awesome for those people to be stuck at the clinic with you for months.
Yes. Yeah. Yes, Corona had his good parts too.
Absolutely. And, I just want to, there are doctors watching this, there are practitioners watching this, there are patients watching this, and I just want to encourage you all to reach out to Dr. Rau to find the Biomedicine International. That's the new company, the Biomedicine International, where you're teaching seminars, where you're willing to consult clinics, correct?
Yeah, until now we had Dr. Rau's Paracelsus Academy, but I wanted it to bring a little bit away from my person. Now it's Biomedicine International Academy. We founded a company to do the academy and also spreading the word. So it's no more. Otherwise, it was always a little bit. He wants to sell Paracelsus, so his clinic, and so that's no more needed now, because for me it's really more for teaching, and we have now. I have more than 500 colleagues like you. Well, you are one of the best, of course, but who came to many of my seminars and began to do this treatment. And they say it's very interesting that these seminars, this thinking, that the shift of thinking made my practice totally different and much more successful also.
You've always said in order to get different results, you have to think differently. And you treat the whole patient, not just the disease. These are exactly. Common Dr. Rau little pearls that he said throughout the years. But I just want to give everybody an opportunity to realize that if you're anywhere in the world and you want some consulting, Dr. Rau is available. He's in the fall of his life where he's willing to give out all of his information. Is so exciting. And he's not only consulting clients or clinics rather, but he'll see patients and he'll help the doctors oversee the cases for the very difficult, complex cases. This is not easy. This is a different framework of understanding and a different way to learn it. And they can be puzzles, and you got to look at all the pieces, and to have somebody over your shoulder who's put puzzles together for 30 years and seen all the different types of puzzles and knowing every puzzle is unique but has some commonalities is absolutely amazing to have that access. And also you're providing some remedies, you're partnering with different clinics, and you're also getting them, correct me if I'm wrong, whatever new equipment they might need to perform the different testing or therapies that are needed, as well as the specific seminars. I mean, it's just amazing what you've put together with this academy, which is so desperately needed, creating like internships and residency programs with you, essentially via telemedicine and locally. I mean, is there anything more you want to say about that? I could talk about that all day. That's exciting.
Yeah, yes. You know, I was asked so many times by my colleagues, by my students, oh, how can I build up a biological practice in wherever, in Bangalore or in Malaysia or in US?
Right.
And well, then we can analyze what is allowed, what is possible to do, and what is the spectrum of diseases which you want to treat. And then we can build up the whole, I can consult, or we even had several clinics where I went and I said, oh, you can do this. You need so many rooms, you need all these devices and all these medication. Or the best would be you come to my seminars, most of them anyhow came already, and you come to look, you can intern with me in Switzerland, and then you can see what would be doable for you. So I do a lot of
I highly recommend that internship, because that a day, let alone a week with you, is mind-blowing, life-altering, and heartfelt, because you get to see people in incredibly desperate, ill situations, rebounding and recovering from all over the world with all sorts of different modalities. This is not every client looks the same and gets the same therapies, not even close. I mean, it's really incredible to have access to you, Dr. Rau, and to have access to the hospital like that. I call it a hospital because that's essentially what it is from my perspective, where people are really being healed. And if you have the opportunity to do that, I highly recommend it, because that's how you really learn this medicine, seeing it every day and watching it, and then having them come to your center and do it with you hands-on. That's the key.
Mm-hmm. Yeah. But best is to come to my seminars if you haven't been as a health person. You don't need to be a medical doctor. We have a lot of NDs and we have a lot of DOs or chiropractor.
Acupuncturist.
Yes, we have these kind of medical practitioners. So we have many, and we have seminars on different levels. And then you can learn this.
So we'll tie up, because this is, we really appreciate everybody's attention today. I know that Dr. Rau could keep us entertained and engaged for hours and hours, but I do want to let him go and have the rest of his day. But I do want to say, is there anything else that you would like to say, everybody, to get their own regulation intact, or one little pearl of wisdom that you could offer here on Not Meds, which is naturally oriented therapists, medically enlightened doctors and specialists, to engage people to understand how their body really works?
That's difficult to say. One thing which is very important is, if you want to change your body, you have to do the treatment long term. You have to integrate yourself, and you have to also to integrate your nutrition. Nutrition is one of the very important key to getting healthy. You really have to change normally. And the detoxification is my experience with all these severely sick patients. Detoxification is a very important part. And these are the 2 points which you are not told by the so-called specialists, by the orthodox doctors. And these are the important things. You have to integrate yourself as patient into your healing. Healing
have
is
to be
not
engaged. You have to be engaged in your own healing. And at one point you had said to us, it takes about half the amount of time to get well as you've been sick. Do you still believe in that philosophy?
Absolutely, yes. It takes very long to, it takes, in my book I described how long it takes to really change the body to a difference.
And both of Dr. Rau's books are in our library, so you can access them there. And you can access Dr. Thomas Rau. You can email him. He's offered up his email. Can I give out your email?
Yes.
office@drrau.com. We'll put this all at the bottom of this as well. We'll put his website and we'll put access. Something else you want to say, Dr. Rau?
It is office@Dr. Rau, D-R-R-A-U, Dr. Rau, no .com.
Office@drrau.com.
Exactly.
Wonderful.
Exactly.
Well, from our heart to yours, we hope you have a much better understanding of how the body really works. I very much thank you, Dr. Rau, and so appropriate on my father's birthday that we would give this information out to people. I feel it much honors his legacy and my legacy to really educate people on how their body really works. And I'm getting emotional because this is so heartfelt for me. This is such an important day for me, and all my circles are here. And thank you for being part of my journey and letting me be part of yours, Dr. Rau. I truly, truly love you and all that you've done for us here in the States and the world at large. And so if you want to know when we're going to be here, subscribe to our podcast. Make sure you hit the notification button, and we'll see you next time on The Beats with Kelly Kennedy. Thank you so much.
Okay. Thank you. Bye-bye.